So after completing my medical school in National University of Singapore and after completing my national service obligations, the first clinical rotation I was rotated to was the Department of Urology at Singapore General Hospital. There I was exposed to urology as a clinical posting. Fortunately, I was given a traineeship position after that posting and to continue my training in urology. During my training, I noticed that there was a lack of clinical services for men's health, specifically for andrology and subfertility in Singapore and in the hospital. So I decided to focus my training then on this area so as to provide patients who suffer from these conditions better kind of treatment. So the mission of urology practice is to provide cost-effective care in the private healthcare sector for patients. I think patients often equate private healthcare with very expensive medical bills, and I would like to challenge that misconception and show that quality healthcare can be achieved without breaking the bank. I often see patients with a wide myriad of male conditions, for example, erectile dysfunction, male subfertility, kidney stones, enlarged prostate problems, and hematuria, which is blood in the urine. They often come hand in hand together, and patients may have more than one of such problems. As some of these issues are quite sensitive to talk about, I provide them with a very discreet and professional environment so that they are more comfortable in disclosing some of their symptoms. The main services we provide include the checkup and treatment for male fertility, prostate enlargements, kidney stones, and erectile dysfunction. Certain specialized treatment that are not offered in the government restructured hospitals or other private clinics are also offered. But before embarking on such treatments, patients are always counseled regarding their effectiveness and side effects before we actually perform such procedures for them. So the things that I mentioned, like the bedside ultrasound or even a uroflowmetry, these are conditions that help us assess the condition of the prostate and whether or not it's causing any obstruction to the urinary flow. By looking at the results of this test, we can better advise the patient what needs to be done or even whether anything needs to be done. For male subfertility, we usually perform a semen analysis for this patient. This is to look at the concentration, the motility, or how well the sperms are moving, and the morphology or how well the sperms look like under the microscope. This will give us an idea on the quality of the sperm parameters. Besides that, we do a hormonal blood test for the patient and also an ultrasound of the testis, which is the main factory for the sperm. Looking at all the results, we can then advise patients what needs to be done to improve their sperm parameters and to achieve a pregnancy outcome. So the initial visit of a patient will usually include a detailed history taking, physical examination, a bedside ultrasound if necessary of the prostate and the kidneys, uroflowmetry to check on their urine flow, and some blood or urine tests depending on the complaint that they present with. A patient should always bring along their past scans, for example their ultrasound scans and their CT scans, and medications if they are unable to recall accurately what they are consuming. While most patients usually come with a referral letter from their GPs or specialists, it is not 100% necessary unless their insurance plans require them to do so. So first, I would like to assure them that they are not alone and that many patients actually suffer from such conditions. Usually by knowing that they are not the only ones suffering from such conditions and it's a very common condition, they are more open to share more about their symptoms. They also usually have their spouse or their partner in the consult room together so that it can be a joint decision making and correct any misconceptions that they may have. So through my consult with the patient, I actually hope patients understand their conditions better and just to even know how small lifestyle changes or minimally invasive treatment options are able to totally transform their lives. For example, just drinking adequate fluids daily or avoiding certain food can dramatically reduce a patient's chance of forming kidney stones. Another example, just by daily exercise or weekly exercises, patients can improve their cardiovascular health, which would also help in their erectile dysfunction. So not everything needs to be treated with medications or surgery, but just by tweaking their lifestyle changes and taking more responsibility for their health, we can actually improve patients' conditions and outcome. So some of the misconceptions are that the reason why a couple cannot get pregnant is usually due to the female. We know that quite a large proportion of fertility issues lie with the male. By challenging that misconception and getting the males to come forward to do a semen test and to take some supplements if necessary, we could actually improve their sperm quality and maybe even achieve better pregnancy outcome without for the women to even undergo IVF or other artificial reproductive techniques. So the easiest way to make an appointment with our clinic would be to call our clinic hotline or WhatsApp number. Patients can also book their appointments through our website. The clinic is located centrally at Mount Elizabeth Medical Centre in Orchard Road. This location is very well connected by public transport, for example the MRT or the bus. If patients drive, they can park directly at the Mount Elizabeth Hospital, or they can park at its surrounding shopping malls like Paragon Shopping Centre or Lucky Plaza.